everybody. It's been quite a while since I've been on here. Um, just been working a lot and trying to honestly just relax when I have time off. So, sorry that I haven't been here very much recently. I know it's been quite a while since I broadcast last. Um, I hope that I catch you all at a good time. I hope that if you catch the replay, I appreciate you re listening to this. But basically, just I don't have any like groundbreaking information to share. I just wanted to come on here and just talk off the cuff, answer any questions anybody might have. Um, I'm currently off for a couple days, so I might actually try and broadcast a few days in a row. I might try and structure something a little bit more structured the next time I actually come on here. So, um, thank you for anybody that's in here. Um, and like I said, thank you for anybody that rewatches this later. Um, for those of you that don't know, I am in Florida, Central Florida area, and we have seen a huge uptick in the number of COVID cases coming into the hospitals. One of the biggest things that we're seeing is unvaccinated people coming in at an alarming rate, actually. We are currently in my hospital system, which comprises of over 10 hospitals in the general area. Um, we have seen our largest surge since the pandemic started initially. And this is what we're considering the fourth wave. And this wave kind of makes all the other ones look like ripples in the pond at this point, as far as the sheer numbers of people that we're seeing in the hospital. We have, um, read an email from work earlier today stating that we had over 1,100 cases spread out among our different hospitals in the area. I know my small hospital, um, just the other day, over 54% of our population in the hospital was COVID. Um, and our ICU, which is normally a 12-bed ICU, and we normally run with a census of around between 6 and 10 patients on any given day. Um, we're running with 18 people or 18 patients at max, averaging about 13 to 14 ICU patients. And of those 13 to 14, up to 18, typically all but one or two are actually um, COVID patients. So we're seeing a huge uptick, like I said, in COVID patients. Hey, Tori, thank you for coming in. It's good to see you. Um, but yeah, so we are seeing a lot of COVID cases coming in. And we're at a point now where, as a nurse, and I've spoken about this with several other nurses that I work with as well. Uh, we're kind of at a point now where a lot of us are just burnt out. We are we're over this. The vaccine has been available for 9 months now for many people. Uh, I got my first dose of the vaccine in December of last year, my second dose in January. And there are still people out there that are coming into the hospital unvaccinated, thinking that they didn't need to get it, that they would just beat it, that it's not that much more than a flu. Um, and we've had people um, as young as their 30s dying of this in our hospital. One of the things that when the first wave kind of come around, it was older people, and I think some people kind of pass that off as, well, older people have lived long enough. They don't really. It's not that big of a loss to lose uh, the older generations. but it still is, because it's still traumatic to those families. It's traumatic to those um, children of those people, the grandchildren of those people. But now we are seeing people my age and younger that are dying of this, that are literally dying. Um, I do know that the youngest person that we've had on my unit has been in their low 40s, and the lowest person that we've had in the hospital, or the youngest person we had in the hospital, that individual was in their mid 30s. Um, and wasn't all that sick really either. Wasn't requiring huge amounts of oxygen. Wasn't even in the ICU. This particular person was on a regular medical surgical floor being treated for COVID. Uh, and they had been checked on at one point throughout the day, and they were fine. And the nurse was going about their business, doing rounds on their other patients, doing stuff, making it back around to that room, walks into the room, and here's this person laying on the ground, dead. Like dead, like purple dead. Like this person had not just died, this person was dead. Um, and it was pretty much concluded that this person probably died of a pulmonary embolus, which is a blood clot, which is a very bad side effect from people getting COVID. People are developing these blood clots, and we've seen this in microvasculature as well, all the way down to the capillary level when they've done autopsies on heart and lung tissue and brain tissue. They see these little microclots in the on the slides underneath the microscope that are causing these um, people to have things like what we call COVID brain, where even if they are recovering from COVID and they make it out of the hospital and they're still alive and they're doing okay, they have this fogginess to them. They have this kind of a, don't want to say a forgetfulness, but kind of like they're not all there anymore because at the cellular level, because of these microclots, it's caused brain damage. And once brain cells are gone, they don't come back. They can't be retrieved. They can't be fixed. Once the brain cell dies, the brain cell is gone, just like the heart cells. When the heart cell dies, it's gone. So it's hard to watch these people come in, and a lot of us, and like I've said, I've spoken with other nurses as well that I work with. Um, we've kind of gotten to a point where we're kind of out of compassion for some of these people, because, like I've said, we've had 9 months at this point to get a vaccine for many people that are refusing to do it, and they're still refusing to wear masks. They're still refusing to socially distance, and they're coming in. And one of the last things that one of our patients that recently died had said to their spouse over um, FaceTime, because that's the only way they can communicate with their loved ones, is we have a FaceTime tablet that we can take into the rooms and allow them to use, is "I'm sorry." That was the last thing that this person said to their spouse. Uh, they ended up dying later that night. Uh, I don't know what that person was saying they were sorry for, but maybe it was a sense of impending death coming upon them. Like they knew that some people, they say, some people know when they're going to die. Some people know when the end is imminent, and they feel that weight, or they feel that pull towards the light, or whatever you want to call it. Um, and it's hard to deal with. It is. It's hard to deal with on a daily basis. Um, we are seeing more and more and more younger people coming in, people 60 and under, people 50 and under, people 30 and under, that are severely sick with COVID, that are at a point where they're requiring uh, large amounts of oxygen. They're requiring intubations and life-saving procedures. There is a treatment that we call ECMO. It's basically like a heart and lung bypass machine, where they hook these tubes up to you and they pump your blood through this machine, so the machine will actually oxygenate your blood because your lungs aren't doing the job it's supposed to. And it gives your lungs and heart a little bit of time to rest and recuperate. Um, it's a therapy that's been around for a number of years now, um, but it's not something that every hospital offers. It's only typically available in the largest hospitals. The hospital system that I work for, I believe we only have, excuse me, hold on. Sorry, I did not want to clear my throat on the microphone. But the hospital system that I work for, I believe we only have 2 hospitals that offer ECMO. And in one of our last emails we received from one of the higher ups, there's a wait list for that machine, for that treatment, because we only have so many ECMO machines. We only have so many trained nurses that are able to run this ECMO. It's a very specialized process. It requires 2 people to take care of this one patient. You have a nurse that takes care of the patient themselves, and you have an ECMO specialist that all they're doing is looking at the machine and keeping the machine running, looking at the numbers and the values and the flow rates and stuff like that to keep these people alive with this machine. So it's a very labor intensive process. It's not something that, oh, you can just go get ECMO and get better, or you can just go get a ventilator and get better. It's not like that for a lot of people, and we're seeing um, people that do end up long term on a vent after having days and weeks of high pressure ventilation, trying to force their lungs open. Is causing lung damage. It's causing people to have tears in their lungs where they develop a pneumothorax, and which is air on the outside of the lung, which causes the lung itself to collapse, which then requires another intervention, a tube uh, cut in between the ribs and stuffed into that space so that we can suck the air out. Um, and it's not a pleasant thing to go through. It's not an easy thing to go through. But like I said, I haven't been here very much recently. So I just kind of wanted to come on and talk kind of about the state of what I'm seeing, where I'm at, and kind of what's going on. We are seeing, like I said, so many more cases now coming in. The small hospital I work at, even during the worst part of the previous waves of the pandemic, our ER is fairly efficient, I will say. And they do a good job of getting people seen, getting a doctor to see you, get a nurse to see you, see what's going on, without a whole terrible long wait most of the time. And even during the highest points of the previous waves of the pandemic, I mean, we've had people, if you had to wait for 2 hours, that was kind of about the max. We're having people wait 4, 6, 8 hours before they're even able to be seen. We're having nurses go out in the parking lot. People are sitting in chairs outside of the hospital, and they're starting IVs and starting IV infusions and medications for some of these people that are coming in with COVID to get them medications like Regeneron for people that definitely they're sick, but they're not sick enough to require hospitalization. They can give medications like Regeneron, which is a one-time dose to kind of help boost the immune system, to help the body fight off the COVID a little bit better, which seems to work for a good majority of people. But that's not a definite. It doesn't work for everybody. Hey Jane, thanks for coming in. I appreciate it. But even like I was saying, Regeneron, it's not for everybody. It's not if you come in and you're too sick. We've had multiple people coming in recently that either they're driving themselves there, or they're bringing themselves or loved ones driving them in, and within 30 minutes or an hour, they're going from sitting there alert and conscious, but not quite all the way with it, to being intubated, putting on a ventilator. And then we don't have room up in the upstairs in the ICU to take care of this patient. So they're remaining in the ED. The ED can administer the same level of care that we can, but it's not an optimal situation. It's not an optimal place to be, because the ED gets busy at times. There are things that happen in the ED that don't happen in other places in the hospital. They have to be able to take care of emergencies that come in through the door at any given time. Whereas when a patient makes it up to the unit, we're kind of anticipating what they need. We're kind of looking ahead to see, okay, this is the next step. This is what needs to be done. Whereas in the ED, they don't know what's coming through that door. Is it somebody with a broken finger, or is it somebody with having a major heart attack? They don't know. They don't know until that person gets there. So it's not the most optimal place to leave a patient requiring an acute level of care. But like I said, they do their best. They're trained to do it. They have the skill and the knowledge to do it. It's just not the optimal place for them to be, unfortunately. Let's see, I think there's about 6 people in here. Tori's in here, Jane's in here. Thank you all for coming in. Anybody else? If anybody has any questions, just feel free to ask. I can answer most things COVID related at this point, or if I don't know it, I can point you in the right direction. So, cheers, everybody. So, but I've just kind of been at a point now recently where you're wondering about the booster. I'm actually trying to go get my booster. I'm going to go try Jane tomorrow to do it, because I'm immunosuppressed. So I qualified to get it immediately. I just have to find some place that has Moderna. The one place that I went to today, they only have the Pfizer vaccine. So I found a place. I'm going to try and go by there tomorrow, get my shot. Hopefully they have it. And if they do, hopefully I'll be able to get it. The newest recommendation from the CDC has just come out too, that I saw. I think that was, I can't remember if that was yesterday or today. All the days kind of blend together. I've worked so much recently. Last week I worked like 8 days in a row. This week I've only worked like 3. So, but I have a couple days off in the moment, so that's nice. But newest recommendations for the CDC is saying about 8 months from the date of the second shot. Yeah. That's the recommendation, but that hasn't started yet as far as I know. So I'm at that point right now, having had my second vaccination in January. Well, I mean, I'm at that point because I'm immunocompromised. But then finding a lot of the places around me seem to have the Pfizer vaccine. So it's been a little bit harder just to go walk in somewhere and get the Moderna vaccine. With immunocompromised, there is basically, I actually went and talked to a pharmacist at one of the CVS's near me today. And I asked her, I said, do I need any documentation by doctor? Do I need like a prescription for it or anything like that? And she said, no, you basically just have to come in and you can get the shot. You would, I mean, I mean, it's kind of like on an honor system, I guess. Um, because my first two doses were Moderna. So they recommend that you get the dose of whatever we had previously. And so that's why I'm going to get Moderna. The other thing too, and I hate to say this, but the Moderna vaccine does seem to be a little bit more effective against Delta variant by a couple percentage points. Um, and I will say that in my general area, I do know that Pfizer was much more readily available for the general public when it first came out. So I don't know if that has anything to do with it, but I've seen more people coming into the hospital that are sick that have had Pfizer than have had Moderna. Um, Not to say that one is any better at protecting these other people, protecting than the other. But what I've noticed is the people that are still coming in sick, even though they've had the vaccine, are people that are in high risk categories, people that have multiple comorbidities, people that have a lot of chronic health problems that put them at higher risk for any type of respiratory disease or respiratory process that's going to um, impair their lungs, whether it be just a regular pneumonia or even the flu. Those are the types of people we're seeing coming in that have had the vaccine. But those are very, very small percentage of our patients. The majority of our patients that are coming in are still unvaccinated, uh, are uh, still haven't even gotten their first shot. And we've had a couple of people that have come in and they're like, I just got the first shot and then I was exposed and I got sick. And uh, I mean, that's happening as well because with just one shot, you haven't built up enough immunity to be able to create enough antibodies to be able to fight off an infection if you do get it. So that's kind of where that's at the moment. But the test was negative. Yeah, I mean, that's one thing. It's hard because the symptoms are so similar to so many other respiratory illnesses. Whether I mean, we had a patient come in the other day that they swore up and down this guy has COVID. He has COVID. He's got all the symptoms. Uh, but this patient had lung cancer. This patient actually had just rhinovirus. Uh, wasn't COVID. I mean, he had an infection, but it was another viral infection, rhinovirus, which is more common among kids. You see that typically in kids. And for very young kids, it's actually kind of scary for a real young kid to have a kid under the age of 1. Um, but um, yeah, cough and a sore throat. A sore throat is not one of like the top symptoms. It is a symptom, but it's not one of the top symptoms still with COVID. Uh, what they're still looking at is people coming in with fever, chills, body aches, loss of smell and taste. That's still a symptom that they're really keen on. Uh, so, I mean, just a sore throat and things like that, while they are symptoms, like I said, aren't as high on the symptomology list. They're not as common with people with COVID. It's not to say that somebody has COVID doesn't have a sore throat. It's very, very possible. It happens quite a bit, uh, but it's typically those flu-like symptoms, those body aches, those chills, those uh, very high fevers. Um, is typically there's a difference between like a viral infection and a bacterial infection. That's one thing we look at in the hospital as well. Somebody that typically has a viral infection comes in, they have a fever, it spikes up really fast. You're going to have a fever, it's going to go over 100 really quick, 101, 102, 103. bacterial infections, they're kind of slower uh, to take over. They don't replicate as quick. Bacteria is a little bit slower to do its thing. So a bacterial infection, typically you'll see lower grade fevers. Somebody will have just slightly above normal, or 99, maybe 99.9, or just at 100. Uh, so that's another easy way to kind of differentiate between a viral infection versus a bacterial infection. Yeah, and it could have just been some cold virus. It could have been anything. Um, I mean, my kids have been sick a couple times recently, and I mean, I don't think that they've had COVID or anything like that, but because their symptoms, they kind of they come, they're there for a day, and then they're gone. They feel better right the next day. It's just a little small, like the common colds that kids pass around with each other, especially now the school's started. Um, and one thing in my general area, Hillsborough County, which is close to where I live, they've had a huge number of cases. I don't know if anybody's seen that. It was in national news at yesterday and today, I believe. But they've quarantined over 8,000 people uh, in the school system, students and teachers. I think they have about 130 positive teacher cases, and somewhere, the last I heard was about 700 to 800 positive student cases at the moment. Um, and we have Ron DeSantis here trying to defund the school system by saying any school system that requires a mask mandate is going to get their funding cut. The administrators will not receive paychecks, or they'll have their funding slashed, um, which is one of the most ridiculous things I've ever heard. Um, it's very easy for him and his wife and his kid. His wife, he and his wife who are both vaccinated, and they send their kid to a very prestigious private school that they pay god awful amount of money for, where I'm sure that they're taking all the precautions possible. Um, but telling school administrators, and especially in areas where COVID is very rampant, that you can't require masks or we're going to take away your funding, to me is just ridiculous. I have more choice words, but I don't want HAPS to suspend me or take my account away. So that's really about it. I don't have much more to talk about. Like I said, I just kind of want to. My prediction on when we'll all be okay. We need 80% of the people to get vaccinated or higher. We are a long way from that. We are a very long way from that. I think some of the countries with some of the highest vaccination rates are actually in the Middle East. United Arab Emirates, I believe, leads the world in people with the most vaccinations. And that country is tiny compared to the United States, but still. Um, and then there's a lot of places like Singapore. They're very high on the vaccination, uh, the number of vaccinated people in their country. But those are places that also have taken this seriously since the very beginning. That even before COVID had predictably reached their shores in places like Singapore, January of 2020, Singapore was requiring all school children to wear masks, all educators there to wear masks. That was in January of 2020. That was before it even reached there in Singapore. But if you look at the caseloads and the number of deaths they have there, uh, they did a good job by doing that. They haven't been testing enough people at all. They haven't been. the restrictions were not put in place early enough. A lot of this could have been mitigated in the beginning had we had leadership that would have taken this seriously, because Trump just totally fucked the pooch on this, pardon my French, when it came to actually taking this seriously at the beginning and actually doing something about this. And then his lackadaisical attitude towards the entire pandemic, which was then followed suit by a number of other countries, Brazil being one primarily, where their cases are through the roof, and they have been for months and months. In other countries that looked at Trump and they're like, oh, we're going to model after him. Whereas you look at countries like New Zealand, who had not had a case in a while, had one positive case the other day, and they went into lockdown in New Zealand again over one case because they're serious. They don't want it spreading. They don't want Jacinda does not want her people getting this disease running rampant in the community, which is a smart thing. And we did not do tracing and tracking to figure out who these people contacted, where they were, who they came in contact with at the beginning to try and quell this. A lot of steps were missed or just totally omitted that could have helped mitigate this pandemic. Yes, it would have been bad in places where they didn't know any better at the beginning. Italy, before it even reached our shores, Italy was getting hit hard, very hard. Italy also has a very large geriatric population in Italy, but that's not to say that younger people weren't getting it there too. They were as well, but the majority of the deaths that happened in Italy were in the older population, the people that were more vulnerable to respiratory illnesses, the people that probably had more comorbidities, had hypertension, had diabetes, had hyperlipidemia, had other different things that put them at increased risk for dying of COVID. So if we had had proper leadership at the beginning, I think that other countries would have followed suit. Other countries would have seen what the US was doing and mimicked what we were doing to try and mitigate the spread of this disease. And it would not be as bad of a worldwide pandemic as it is. So at this point, I don't blame Trump for the 600,000 plus deaths here in the US. I blame him for the millions of deaths across the country, across the world at this point, because his lack of leadership has cost the lives of not just Americans, but so many other people across the planet. I was just actually speaking with one of my pulmonologists about that. When was that? Yesterday, the day before. So 2 days ago, early in the morning, I was speaking with the pulmonologist about that work, who's one of our intensivists. He said that everything that he's reading, everything that he's privy to, all the information that he's able to get his hands on at the moment, shows that they will probably be rolling out vaccines for kids under 12 by September at this point. So that's kind of what I'm hoping for. All the tests are coming back very positive for young kids getting the vaccine. I don't know, and I would have to research it myself to see what the age range is, because I'm sure there's still a cutoff. I'm sure that they're not giving it to newborns, to even 1-year-olds or something like that. There might be a cutoff of 3 to 4 years old. I don't know what that is yet. But I do know, like, my oldest daughter, she is vaccinated. My younger 3 children are under that age of 12, so they can't get it yet. But when it is available to them, I will get it for them as well. Because I would hate to see something happen to them. I really would. But but that is the best information I have is literally from one of our. He's actually, we consider him to be like our COVID expert at our hospital. Um, the man is a machine. He literally, when I saw him the other day, he was on day 17 of 20 in a row. I don't know how he does it, honestly. Um, and he's got young kids too. He's my age, or maybe a couple years younger than me. But he's got kids, so he's very vested and interested in when that's going to be available for his kids as well. Florida's been in school. Florida, most of Florida, I believe, has already started. Um, the county where my kids go to school, the neighboring county, started last week. The neighboring county, Hillsborough County, has already quarantined over 8,000 people. They've had over 100 and I think it's 130 or 160 positive staff cases and over 700, close to 800 positive student cases already in Florida. And a lot of the neighboring county, Hillsborough County, close to where I live, they had kind of Ron DeSantis. I don't know how familiar you are with Ron DeSantis's rule, Jane, about the fact that he put out an executive order stating that any jurisdiction, or sorry, not jurisdiction, any school district that mandated masks was going to have their funding cut for administration. And one of the ways that Hillsborough County figured out legally to get around that mandate was to offer a opt-out form because it legally circumvented exactly what Ron DeSantis's executive order stated. They could still mandate masks with the option to opt out with written parental consent. Well, parents were flocking to this. They were just like, yeah, we'll send in the consent. We don't want to send our kids to school in masks. And now that's backfiring because Hillsborough County is one of the highest infection rates of COVID cases in the country at the moment for school districts. I did see a little snippet on the news in a patient's room the other night where they're talking about at that point, I think they had 600 positive cases between between staff and students. And they said at that point, and this is only 2 weeks into the school year, that was at 2 weeks into the school year, that was over 10% of all of the cases that they had for the previous school year. In the previous school year, they were doing distance learning for a majority of the school year as well. So they weren't even in classes, and they were still we still hit 10% of the positive cases. Because once this really hit our shores is when they went to distance learning in a lot of places, where my kids went to school in Hillsborough County at the time as well. Since then, I've moved. I'm in a different county. But the county I live in is not requiring masks at all. And I watched a YouTube video that was sent out by the superintendent of schools for our county, stating that he thought it was silly to burden the parents with an opt-out form the day before school starts, which I think is a huge mistake. I think it's going to backfire in this county as well, in Pasco County. The only thing is Pasco County is not as densely populated as Hillsborough. Hillsborough County is where Tampa is. So you have much more, I don't want to say metropolitan, because Tampa is not metropolitan like you think of, like New York or Los Angeles or San Diego or someplace like that. But it's very, very, very suburban. And there are some diverse areas within Tampa. But it's fairly densely populated. Most of the general Tampa area, and even outside of Tampa, and some of the neighboring areas outside of Tampa itself are fairly densely populated because it's right next to Tampa. So, but unless anybody has any other questions, I'm probably going to wrap this up here in a couple of minutes. Like I said, I just kind of wanted to come on here. I hadn't talked in a while. Just answer any questions anybody had. I appreciate everybody for coming in. Anybody that's listening, Tori, Jane, I appreciate your comments. If it comes down to it, my kids will have to distance learn again. They did not offer it as an option at the beginning of school this year in Pasco County. So they will, if it comes down to it, we have to go back to distance learning. That's what we have to go back to, unfortunately. I mean, we set up and did it last time. We'll set up and do it again this time. The only thing I will say is my 10-year-old daughter was able to do it. My 8-year-old son lacks the discipline and the focus to be able to succeed with distance learning. He's the type of student or type of kid that needs to be in the classroom, needs to have a teacher looking at him. So, I mean, it's more work, definitely on the parents' end. But, I mean, it is what it is. We have to protect our children. We have to keep others safe. We have to keep the community safe. We have to protect the teachers, even the ones that are vaccinated. Like I said, we're still seeing people come in to the hospital contracting COVID still with the vaccine. The percentage of them, like I said, getting very sick is low, but there's still always that chance. I wouldn't want to be the reason that my kid took COVID to school and gave it to his teacher, who ends up dying. It's not a burden that I want to carry on my shoulders for the rest of my life. So, but well, thank you, Jane. I appreciate it. I thank you for coming in. I know you said you used to always catch my replays. I tried to get on a little bit earlier tonight. It's only, it's 1 o'clock, almost 1 o'clock now. But if I might try and get on a little bit earlier I might try and broadcast again tomorrow. But like I said, I might actually try and dig up some information and have some actual facts and numbers and things like that to put out there for people. But I just want to say thank you. Thank you for any replay viewers that make it all the way to this point at where we're at 40 some odd minutes into the broadcast. 44 minutes. So I thank you all for listening. I hope you all have a good night. Stay safe. Continue to wear your masks. Wash your hands. Get vaccinated if you haven't done it already. Encourage others to do the same. Wear a mask when out in public. Social distance when applicable. And still, it's not a good idea to be going to large venues and large events and things like that. When things were looking not so bad, I'm going to end with this though. When things were not looking so bad for a month or two here, our COVID cases are down in the hospital. We had 2 units at one point that were totally dedicated to COVID, and we were down to 1 unit had like 4, maybe 5 COVID cases at any given time. And in ICU, we might have 1, maybe 2, sometimes 3 at the most for a while. Those were kind of the numbers we were running with for quite a while with COVID cases. And then now we're busting at the seams. Over half of our hospital census, 54% the other day was COVID positive in our hospital. But back to what I was saying is that when it was low, we had looked at, my daughter is real big into cosplay. and she likes to do that type of stuff. So she had wanted to go to Comic-Con this year, which happens every year in Tampa at the convention center. And we were going to go. We bought tickets. We bought tickets several months ago because we kind of saw the trending going down. And even if we were going to go, we were still going to wear masks, even if we went. But with the number of cases and the increase and the spike that we saw coming in so quickly, I told her, I said, we can't go. And it broke her heart. And I was sad. It broke my heart to tell her that I couldn't take her. But she's 13, and once she gets past the emotional part of it and the letdown, I can talk to her, and I talked to her about it, and she said, "Dad, I do understand, and I understand why we can't go." Uh, and that kind of it made it worth it. So, um, because even though she wasn't able to go to something she really wanted to, she is mature enough at this point to understand the reasoning why. So, but anyway, everybody have a good night. I hope you all take care. Thank you for everybody who came in and listened. I hope you all have a good night. Jane, Tori, thank you for participating in the chat. Everybody else that's listening, I hope you all have a good night and take care. Stay safe. Wash your hands, wear a mask, and be careful.